Could Lyme illness be treated using white-tailed deer blood? The bacteria Borrelia burgdorferi, which causes the infectious disease Lyme disease, is transferred to people via the bite of infected black-legged ticks, sometimes referred to as deer ticks. Here are some crucial details regarding Lyme disease. 1. Lyme disease is most prevalent in the northeastern and upper Midwestern sections of the United States, but cases have also been documented elsewhere in the nation. 2. The erythema migrans rash, fever, headache, aches in the muscles and joints, and exhaustion are the most typical signs of Lyme disease. 3. If Lyme disease is not treated, more severe symptoms such joint pain and swelling, palpitations, and neurological issues may develop. 4. A combination of clinical symptoms, medical history, and laboratory tests are used to make the diagnosis of Lyme disease. Treatment. 1. Antibiotics are often given orally for 2 to 4 weeks in order to treat Lyme disease. 1. Longer antibiotic courses may be warranted in some circumstances. 2. The easiest approach to avoid contracting Lyme disease is to avoid tick bites. 2. This can be achieved by donning protective clothes, applying insect repellent, looking for ticks after being outside, and swiftly removing any that are found. 3. Although there isn't a Lyme disease vaccine available in the U.S., there are some other nations that do. 4. Lyme disease cannot be transmitted from person to person and is not contagious. 5. Research into the long-term impacts of Lyme disease is ongoing, as is work to improve the disease's detection, care, and prevention. 6. Lyme disease may be a complex and difficult condition to manage, so it's critical for patients to collaborate closely with their medical professionals in order to get the right support and care. Availability of vaccine. 1. In 2002, Lyme-Rix, the only previously available vaccine, was removed off the market due to limited demand and questions regarding its safety. 2. Some nations, such as Canada and Europe, have Lyme disease vaccines accessible, though. 2. In comparison to the Lyme-Rix vaccine, these vaccines use various formulations and might have various efficacy and safety profiles. 3. It's vital to remember that depending on the nation and location, different Lyme disease vaccines may be available and used. 3. The Centers for Disease Control and Prevention, CDC, advises using insect repellent, donning protective clothes, checking for ticks after being outside, and other measures to avoid tick bites and Lyme disease in the United States. 4. It's critical to get medical assistance right away if you think you may have been bitten by a tick or are showing signs of Lyme disease. Treatment using white-tailed deer blood. 1. White-tailed deer blood may one day be used to treat Lyme disease, according to some ongoing study. 1. The theory is supported by the observation that white-tailed deer, which are known to be hosts for the ticks that spread Lyme disease, have a built-in resistance to the illness. 2. Some antibodies found in the blood of white-tailed deer are effective at killing the germs that cause Lyme disease, according to some research. 2. These antibodies are thought to function by attaching to and focusing on particular proteins on the bacterial surface. 3. The use of deer blood as a Lyme disease treatment is still in the experimental stage. An additional study is necessary to properly grasp its potential advantages and disadvantages. 3. Furthermore, it is unclear how the antibodies in deer blood would be removed and purified for use in people and whether they would be secure and efficient as a treatment.